So I'd like to invite one more speaker, and this is our homegrown expert. As David said, you know, great care. He appreciative of the care that he had on the delivery of the baby. And I have to say personally that every time I go to medical imaging at Sechelt Hospital, they are on time, they are on it. It's truly impressive, and the steady hand that guides that process is with us now. So Kelsey Oxley is going to talk to us about medical imaging at Sechelt Hospital.
All right, thanks everyone. I'm very honored to be here, and thank you to the Foundation for the invitation. So my name is Kelsey Oxley. I am the site coordinator of medical imaging at Sechelt Hospital. I just wanted to give it's a very quick overview of what we offer here and what we can provide locally for our coast residents. So we employ, in my department, I have 45 people, so we're a significant part of the hospital and a fairly large employer. We have CT or CAT scan, ultrasound, mammography, x-ray, and fluoroscopy. We're a busy department. We're running 7 days a week, and our CT scanner is now 24/7. So very many thanks to the Foundation for that scanner. I was surprised to hear that only 25% of women 40 to 49 are getting their mammograms, so that shocks me. But we are a screening center here on the coast. We provide screening mammography services for everyone from Port Mellon to Egmont. And I just wanted to run through, for anyone who's not had a mammogram, what that looks like here. So when you arrive at the hospital, we all know what the main doors look like there, but you come in the patient entrance, and then you're going to come through the sliding doors into medical imaging, and you're going to see one of my friendly staff members sitting at the desk, and they're going to check you in and give you one of those very lovely blue gowns that we all love, and you're going to have a seat in the waiting area, and the technologist is going to bring you in, and she's going to take your picture, and this is what the mammogram machine, this is what the machine looks like in our center. So it's digital mammography, and it is a wonderful piece of equipment. Again, that was furnished by the Foundation. For anyone who hasn't had one, they are not that bad. I think it's really overblown how uncomfortable they could be. I get feedback all the time from people who say, wow, that was not even half as bad as I'd heard. And I think, you know, you really have to experience it and know that it's not scary, and everyone should get one. Please encourage young women you know that are 39 turning 40 to make their appointment and get in there. We provide diagnostic mammography services as well. So this is direct referrals from providers to diagnostic imaging, as well as all the fast track or false alarms and true alarms, as Dr. Gordon was talking about, for all of the lower coast as well as Powell River. So there's many women who take the ferry over to us here for their fast tracks. And we do both their mammography and their ultrasound fast track in one day in the same appointment times here in our hospital. So the ultrasound portion, we have 3 general ultrasound rooms as well as 1 echocardiography suite. We do a full range of ultrasound exams, including women's health exams for pelvics and other things, as well as we are a teaching site for 2 of the educational institutions in BC, so the BCIT and College in New Caledonia, based out of Prince George. We take students in ultrasound from both of the sites. And I just want to take a second to encourage anyone who has someone in their lives considering what they want to do with their lives, and if they're considering healthcare, to really look at the programs, not just at BCIT, but at CNC, at Camosun, at some of the places that are offering medical imaging technology education, and let people know that there is a possibility for rural sites like Sechelt to host those students. And we are happy to have ultrasound students with us. We have one right now who's visiting us from the mainland, and she's really enjoying it. And taking students gives us a chance to show off the coast and, you know, hopefully get them to come, you know, relocate here and keep our hospital fully staffed. Diagnostic ultrasound. So back to breast. This is what it looks like here. There's a picture of me with one of my lovely volunteer staff members on what a diagnostic ultrasound looks like. We do targeted and specific area ultrasound here only, and it's often paired, like I said, at the same appointment with a diagnostic mammogram. And we do ultrasound-guided biopsies here at the hospital on a routine basis. So that's where the radiologist and the ultrasound tech are present, and they do the biopsy all in the ultrasound room, and the samples are sent away to the lab, and results take about 2 weeks to get someone a solid answer as to what has been found through a mammogram and a diagnostic ultrasound. How many cases? We do a lot. We did over 2,700 mammograms in the last fiscal year, and that's all types of mammogram combined. We're back up to an increased volume from our pre-pandemic levels. As the coast is growing, we're growing as well, and we're definitely seeing that in our volumes. When I pulled these stats, I was surprised to see we did over 90 breast biopsies in the last year. So we're averaging almost 2 per week here, which I think is pretty significant for local medicine. And finally, future expansion. The surgical services at the hospital are expanding. We will be offering some breast surgical services soon, although I can't speak to the details of it because that's outside of my scope. We are really happy to see further care and treatment happening here locally. And also, those of you who have been trying to book a mammogram will soon see a whole bunch of slots open up because we're going to be hosting the mammo bus, or the mobile mammo unit. So there's just a couple images of what the inside of the mammo bus looks like. We will be parked in our hospital parking lot for a week this winter to help catch us up on our volumes and to help with the wait list that we do have right now. So I just had a very brief overview of what it looks like here in imaging, and I just wanted to thank the Hospital Foundation and all the donors. And of course, the best medicine is local. Thank you.